This little country in the middle of Europe is punching above its weight when it comes to healthcare. One policy that's helping them is known as the Cross-Border Directive, and it's one that Canada could easily implement right here at home. Let's find out more. We traveled to Europe with the Montreal Economic Institute to learn about healthcare policies that could help Canada and spoke to Bill Wirtz of the Consumer Choice Centre in Luxembourg.
The Cross-Border Directive of 2011 gives the opportunity to patients to seek treatment, elective treatment, in other EU member states. Now, of course, there's certain conditions. You need the approval of your GP, you need your referral from your national health insurance. However, for many people, that's a great increase in choice, because it essentially means that if you live in a small country like Luxembourg and you'd rather seek treatment in France or Germany or Belgium, that's easily accessible, including other EU member states. So depending on sort of where you're from and what type of treatment that you're seeking, you get more choice, you have more options.
The policy that Bill is referring to covers all patients in the European Union. So if someone in Luxembourg was waiting 4 months for knee surgery and was in a lot of pain, they could go to Germany or France or Poland and maybe get in next week. The patient would pay for surgery and then be reimbursed by the Luxembourg government. Reimbursements cover up to the same amount the patient's home government would have spent to provide surgery locally. Implementing the EU policy here in Canada would give Canadian patients hundreds of options in other provinces or countries around the world, instead of being stuck waiting for years for surgery in their home province. This approach is especially helpful for low and middle income Canadians who don't have the funds to pay for private healthcare outside their province.
In Europe, we like to think as borders to be something that is seen from Google Maps rather than defining how healthy you should be as a person. If you need treatment and you can get the best treatment in Germany, it shouldn't be the defining factor. I mean, that's ultimately the whole point of these conversations on health policy should be, what is the best way that you can get better? My home country, Luxembourg, already had a lot of that happening because certain specializations were not available. So of course we would seek treatment in our neighboring countries. And it also makes sense actually for the patient to see how it's done in other countries and bring that demand of quality care back to their country. So in Europe, I think we often think of that level of competition between countries as a positive thing. Ultimately, the benefit is giving people choice and improving the systems as it is by comparison.
To learn more about the Cross-Border Directive, visit secondstreet.org.